Okay, let's dive into something that affects millions of us, but honestly, doesn't get talked about nearly enough. It's called peripheral arterial disease, or PID for short. Now, this is a pretty serious condition that often flies under the radar. So in this explainer, we're going to pull back the curtain on what PAD actually is. We'll uncover some really surprising risk factors, and, most importantly, we're going to explore the proactive steps you can actually take to manage it. Let's get right into it.
So, here's our game plan. First, we'll nail down exactly what PAD is. Then, we'll get into a fascinating link with vitamin D that you might not expect. After that, we're looking at two powerful strategies: healing from the inside out with food and protecting yourself from the outside in with proper care. And finally, we'll wrap it all up into a straightforward, proactive health plan.
Just to give you a sense of the scale here, look at this number. 200 million. That's how many people are living with PAD across the globe. You know, this isn't some rare, obscure disease. It is a global health challenge, and it's especially common for people over 70, where it can affect as many as 30% of folks.
All right, so what exactly is this condition that's affecting so many people? Let's get right to the heart of the problem.
Fundamentally, PAD is a circulation issue. The easiest way to think about it is like a plumbing problem inside your body. You see, over time, plaque can build up and start to narrow your arteries. That process is called atherosclerosis. With PAD, these blockages specifically start choking off blood flow to your limbs, and most of the time, that means your legs and feet.
And believe me, this isn't just about having sore legs. The consequences of that reduced blood flow, a condition called ischemia, can get really serious. It can cause pain that makes it hard to even walk. It can lead to sores that just refuse to heal. And in the worst-case scenarios, it can even cause tissue death. So here's the bottom line. PAD is a major warning sign for your overall heart health. It signals a much higher risk for things like heart attack and stroke.
Okay, now that we understand the problem, let's dig into a really surprising piece of the puzzle. There is a fascinating and scientifically proven link between PAD and a vitamin you might not guess.
Now, what's so powerful about this slide is that this isn't just one study. This is what's called a meta-analysis. That means scientists combine the results from 10 different studies to get a much bigger, more reliable picture. And the conclusion? It's crystal clear. You see that blue diamond down at the bottom? It's sitting way over to the left, which shows that across all of these studies, patients with PAD consistently had significantly lower levels of vitamin D.
And this chart, this really drives home just how strong that connection is. The data shows that people with vitamin D insufficiency, meaning their levels are just a bit low, already have about a 10% higher prevalence of PAD. But look what happens with a full-blown deficiency. The prevalence of PAD shoots up by a staggering 48%. That suggests that low vitamin D isn't just some coincidence. It could very